with COVID-19 being on quarantine, at least here in New Mexico, we've been going, 6 weeks, 7 weeks. And we're all kind of weary. You can feel the weight of it. Just unfamiliar territory for a lot of individuals, if you're single, and even families, in that we're in close proximity to one another like we've never been before. And so much of what we've been hearing as a pastor, and this is my wife Stephanie, is a lot of depression going on in our homes and in the lives of folks in our church and just in our community here in Farmington, New Mexico. And so with that in mind, we wanted to try and address some of that. And my wife, Stephanie Castillo here, she is a master's student at Liberty University, working on her professional counseling degree, almost finished up with that. And so we thought this would be a great opportunity to address some of the darkness, really, that's going on in our community and in our homes. And so, Steph, I had a few questions that I thought that we could talk back and forth about and hopefully be helpful for people. And the first one is, what do you think are some of the causes of depression for people right now in this environment of COVID-19?
Well, I think that kind of like what we've talked about, there's a lot of people finding themselves in situations that they're unfamiliar with. Mm-hmm. It's taking longer. Restraints are being put upon them. So it causes us to not really enjoy the experience that we're going through right now.
Well, I know that for a lot of people, what's so unfamiliar, one is I'm not working because I'm not deemed essential. That, for a lot of men, immediately has this effect of, like, well, then who am I? Because their identity's caught up in their job. For wives and who are working as well, that can be a similar problem.
Right.
And now, if there's a large family, they're homeschooling. Mm-hmm. And so there's just a lot of new dynamics that are suddenly thrust upon people, sometimes overnight, right?
Mm-hmm. And I think because often we have different routines than we're finding ourselves in right now currently. So you mentioned work. Typically, a lot of people work. Nowadays, both mom and dad or husband and wife are both working, and now with layoffs or as you mentioned, school being canceled for the rest of the school year, and lots of celebrations and even typical things that would be going on are canceled, or having to think of new ways to transform them and
we
make
had to
them
do that
meaningful.
for our own grandchildren recently.
Exactly.
Where we're normally, sitting in each other's homes and hugging on each other and, having food and nice dinner. And we did like drive-by birthdays.
Right.
And it was heartbreaking.
Yeah.
It really was.
And I think during this time too that people are, there's fear associated with the unknown, a lot of questions, and it feels like every day things are changing. And so a lot of that can bring about, this depression or sadness, grief, loss of identity, as you mentioned, loss of typically, we've known individuals during this time that have lost people,
Oh, yeah.
Death.
Just people that have died from the virus and otherwise,
Yeah.
And what's really affecting people, of course, it's the loss of a loved one, but then not having the opportunity to engage in that normal, if you will, traditional sense way of grieving, which is a public funeral, where family and friends get to come together and console one another, even celebrate to a certain extent, but grieve in a healthy way. Yeah. That's all put on hold indefinitely.
Yeah, I think the uncertainty of, are we going to do something? When will we do something? And for those that are outside, that maybe they're single, there's a lot of loneliness going on, which adds to the depression, the sadness of day in and day out. There's only so many things that you can watch on Netflix or YouTube or
Right, we talked about all the binge watching that even we have done, and
Right.
and everybody's doing that, right? But before too long, you're running out of things to preoccupy your mind, and
Exactly.
so let's talk about that for a moment. When you begin running out of neutral or healthy ways of preoccupying your time, what can we slip into? What are some negative things, coping skills, if you will, for this depression that is beginning to creep into homes right now?
Well, I mean, obviously we see an increase of maybe alcohol consumption, which alcohol is known as a depressant, and it interacts with maybe healthy things that you were doing before, such as, healthy things could be exercising, our negative thought processes, such as, it's easy to slip into those and think about, when is this ever going to end? I'm tired of wearing a mask or going one way down Walmart's aisles or whatever it is,
Or just being
those
afraid to put
restraints.
gas in your car because
Right.
you're afraid that somebody's touched it.
Right,
All
right.
these things that didn't exist just a
Right.
few weeks ago.
Exactly.
Right.
Yeah. And so I think that we become consumed with our thoughts. Our minds and our hearts are always active, and so we're typically, thinking about something, and if we're not careful, the propensity is to think about the negative and not to think about the good. It's very easy to always look at, even as kids, you bring home a report card, and what does mom and dad focus on? They focus on the C's or the D's or the less than good grades. So we have the natural propensity to just look at the negative versus thinking about the positive things that this confinement has brought into our lives.
Yeah. What are some of those positive things that we can look at?
Yeah, I think, you read on Facebook or whatever, some of the things that the difference in views of how families are actually together,
Which can be a great
which
thing.
can be a great thing. They're eating dinners together. I know that it gets difficult at times going, and the restaurant we're going to tonight is the kitchen,
Right.
Or I think Family Circle had some comic strip from way back when is like, I'm tired of eating groceries.
Right.
So I think it's just that, we can look at the positive versus looking at the negative, and it takes practice, and it takes a discipline to even do that. Is to think
you have
about,
to intentionally do it. It's not just going to happen, is it?
Yeah, games, game nights for families, just a lot more time, for those seniors that aren't graduating and heading off to college. Maybe this is a time for families to really capture those last moments before a transition is going to occur.
Right.
So they can look at that as a positive versus a negative. I see more kids out in our neighborhoods with families, right?
Actually, I do too. Exercising together, riding bikes,
Yeah.
which has been a real because you really didn't see that as much. Maybe it's because, prior to this, people were going, to baseball games, soccer games.
Right.
And I totally get that. But this is kind of cool and different in that it's the family unit. Typically in our neighborhood, we're seeing mom and dad and the babies, and they're hanging out together, and they're walking the neighborhood together.
Right,
And so,
right.
so there's a lot of things that I think that we can do that are right there, easy. It's just our families, and that we can just really focus on the positive things.
Right.
But I think the key that you mentioned there is to be intentional.
Right.
And so one of the things that I've found that it's been helpful to deal with my own sense of depression and melancholy kind of thing that I always have going on, and it's been accentuated during this time, is to have a routine.
Right. Absolutely.
And to have purpose, and to have goals. And so I've been real intentional about setting goals. And, it just goes back to like, so I'm going to wake up at this time. So my alarm goes off and
4:30?
4:30. Yeah, even now, which is crazy. I don't know why, but 4:30 I'm up, take a shower, and I'm going to read my Bible, and I'm going to have that time of devotion in conversation with my Father. Somewhere in the mix there's going to be some exercise.
Right.
Everybody's home gymming it, and myself included. But that's that release, and it's helpful just to get that out of the way. And it feels like I've accomplished something significant. Those are goals, met those goals right then, and it helps not only my spirit, my physical body, but my mental state of being as well.
Right.
There's something positive there that is from scratch, from very early in the morning. Like, okay, I'm set. I'm ready to go do something, and so that's been real helpful.
Absolutely.
For me.
I think keeping a routine. If you are, if you have a job, and a lot of people have joked about like how difficult it's going to be going back to work and getting back into a routine. It's almost like summer break. When kids are going back to school. Maybe you didn't pay attention to when bedtime was, or but it's really important, especially now, because to keep that routine, do the typical things that you normally would.
Yeah.
Shower, brush your teeth.
Yeah.
Exercise is such a positive thing to push back against depression.
Mm-hmm.
Sunshine, getting out. For a minimum of 45 minutes a day, drinking water, not consuming so much caffeine, such as, coffee or sodas and stuff like that.
Yeah. Coffee all the time.
Making sure that you don't. I know that there's been jokes about, the 15 pounds of quarantine, just like the freshman 15 or whatever.
Oh, yeah.
But making sure that you're eating healthy and not a lot of sugar, because just like we know that sugar gives us a quick fix, but then it brings us down, and it exasperates the depressive feelings that we may already be having.
Yeah.
And that struggle there. So keeping those type of things.
And, and we're talking about it and kind of, touching upon these things real lightly, but there's a real dark side to this.
Yeah.
There's, again, the increased intake of alcohol, which could then lead to, with drugs or what have you, prescription drugs, all these things are in the increase. And as a result, this has a domino effect. And so now there's a lot of domestic violence, between husbands and wives, and then children, and and just otherwise, and crime is on the uptick. Mm-hmm. All of these things are related, and a lot of it stems from this personal darkness of not being able to cope in a healthy, even godly way with one's environment. And so we've talked about some of these kind of things that we can do, just for ourselves, having good routines, eating habits, exercise, and whatnot. But what spiritual resources do you think people should avail themselves of if they feel that they're spinning out of control?
Well, obviously, you should ask for help. There's nothing wrong with asking for help and recognizing that maybe it's gotten further than it has, maybe it's gotten, that there's more bad days than good days.
Yeah.
Talking to your physician, which I know is kind of difficult nowadays, but telehealth is available, and so maybe medication would be an option. But spiritual, I think absolutely reaching out to your pastor, to a friend. Don't wait for somebody to make the phone call to you. Call them, because I don't think a lot of people know exactly what is, what each person's going through or experiencing. And so,
yeah, we're all we're all in the same basic environment, but we're processing it at different places.
And I think there's different times that you, you ebb and flow. For those that are typically upbeat, maybe the wear and tear, the longevity of how long it's going makes it a little more difficult for them to stay positive.
Yeah.
And if you already are kind of a melancholy person, or an introvert or whatever, maybe initially this was a great thing. But the longer that it's going on, you're finding that it's becoming more of a struggle.
Right. I personally sense in myself to a certain degree, and in our community as a whole, there's a weariness that, like, if I go and I ask somebody, how are you doing? They're saying like they typically would, well, I'm hanging in there, but there's a different gravity to that statement. Yeah. It's like, I'm tired, man. Yeah. This is really wearing on me. And so that's why I think the spiritual aspect is so just essential at this time.
Yeah. We've talked a lot about how many times throughout Scripture we're the children of Israel. God's people are reminded of who God is and who they are and what He has done. And those are really positive things. So I think it's remember. Yeah. Remember, who you are as an individual. Like, remember what God has done for you. Remember who He says He is in the midst of all of this.
And I think something that I learned from Dr. Don Whitney, and what I do every morning as a part of my conversation with God, is to meditate and pray through the Psalms. Right. Because it hits on all those things that you're talking about, remembering who God is, what He's done for you the past, and just hearing the heart of those psalmists as they pray through trouble and just seeking God's face, looking to Him as a refuge in the midst of that trouble. And so I have found just a great place of refuge myself by going to the Psalms and meditating on them a lot.
I think what we've said is that the Psalms are so rich with and so applicable at this time, maybe more so than any other time that we've maybe
certainly more immediate.
And I think just like Paul says in 2 Corinthians chapter 12 verse 9, that remembering that God's grace is sufficient and His power is manifested in my weaknesses. And so like in this time,
that's what this means. I'm weak.
Exactly. I'm weak. I need you.
Right. What are some other resources people could look to? Of course, there's their church. There are pastors that they can talk to. There's their brothers and sisters in Christ. But how about mental health professionals like yourself?
There's counselors here in our community that I know that are, it may not look like it once did during this time, and it will return back to face-to-face, sessions or whatever. But during this time, I know that there are counselors that are still taking clients, with anything. If you are having a moment or whatever, it's really important to, if you feel like you're going to harm yourself or you feel like you're being harmed, you've got to call 911.
Right. That's the most immediate and the best thing you can do, right?
Absolutely.
If you're to that place, if you feel like you're going to hurt yourself, hurt somebody else, or somebody's going to abuse you,
right.
Go ahead and make that call. And make sure that you're safe and you get the appropriate health care.
And of course, San Juan Regional, I know people are fearful to go into the hospital right now, but those resources are still available.
Absolutely.
And and they can do referrals to, if you don't have a doctor, your own personal doctor or whatever, to get help. Everybody needs help at different times, and there's nothing to be ashamed of. I need help, and so what do you do when you need help in other areas of your life? You reach out to the people, and so I think that those are the important things, and
we want to be there for you as well. And so if you're feeling the weightiness of this time and the depression creeping in, we want to hear from you. And so you can email me. This is the best way to get a hold of us, and that's at tim@gracehill.church. And just let us know what's going on. We can pray for you, and we can be a resource for you and find other resources. We want to serve our community well, love you well. And so we want to thank you again for your time joining us here. May God bless you. Thanks a lot.